So thank you for your introduction, Dr. Kavita, and thank you, Dr. Suresh and Dr. Kapoor, for inviting me here, and the respected Professor Ramesh Chand and all the experts on the dais and the experts in the audience. And I would like to start off by saying that the calculation of protein intakes of the population in our country is wrong, for the simple reason that we don't correct for the digestibility of the protein. We only calculate the crude protein intakes, and that gives a wrong impression that probably we are consuming more protein, adequate amount of protein. How do we go next? So now, of course, we know that what has already been mentioned about the quality of the soy protein in terms of digestibility, it scores over all other legume proteins. So we need to therefore calculate the protein digestibility based on the kind of protein, and since cereal proteins contributing almost 25 grams of protein per person per day, if you actually see, it will work out to only 12 to 14 grams will be the bioavailability and the ultimate calculation. So if you calculate that way, our protein intakes are much less. This is probably the reason why we seem to be consuming almost 80% of our protein intake, but our muscle mass is very low. We have more fat and less muscle. Now, these are, of course, the amino acids, and the methionine is one limiting amino acid. Even in soy, the methionine content is slightly lesser, but it is considerably more than all other legumes. And of course, these are all the methionine requirements. I'll skip for the want of time. And for Indians, it's around 15 milligrams per kg per day, and we need to therefore calculate based on the proteins which we consume whether we are actually getting the adequate amount of methionine. But in a cereal pulse-based diet, so more often the amino acid requirements are met. I once again say it's the digestibility which is the main limitation. So we need to calculate some of these parameters like protein efficiency ratio. That is, if you give protein to an animal, for every gram of protein the animal consumes, what is the extent of weight gain? So you look at the first column. For eggs, it's around 3.9, whey protein is 3.2, milk it's 2.5, soy protein is 2.2. So it is coming, as far as protein efficiency ratio is concerned, it is coming very close to milk. Then you look at the biological value, which is the actual amount of protein gets deposited in our body for every protein, 1 gram of protein which you take. For eggs, it is 100. For whey protein, it is 104. The reason why whey protein is 104 is it contains leucine. Leucine stimulates the synthesis of amino acids, proteins in our body. That's one of the reasons why most bodybuilders take whey protein, because they want the entire protein to be converted into muscle. And the biological value in milk is 91, soy protein is 74, and the next nearest legume protein is the pea protein, which is 58. Then we have the net protein utilization, which is the percent of protein retained in the body for the amount which is consumed. For eggs, 94% is retained. For milk, 82% is retained. And for soy protein, it is 61. So unless we make this kind of calculation, we really do not know how much of protein our people are consuming. Then coming to anti-nutritional factors are present in every other food because it is what nature has provided to the grain, and it is very ironical that it's only the soy's anti-nutrient properties are highlighted. And these are supposed to interfere with digestion, absorption, bioavailability, but they're present mostly in the raw legumes. And these are phytates, lectins, phenolics, enzyme inhibitors, and saponins. But when you process them, almost 80 to 100% is removed. And processing doesn't mean any sophisticated one. As simple as soaking, heating, roasting, boiling, as just now Dr. Sridevi also mentioned. But even low levels of these anti-nutrients are now known to have health benefits. They are known to lower the blood glucose, lower cholesterol. In fact, Suresh mentioned that we should be making a health claim that the soy-containing substances actually lower cholesterol. And this, of course, is the dietary guideline showing how much protein is coming from the various sources. So this was only meant to highlight. Now the requirement, of course, is we have the estimated average requirement, which is 0.66 grams, which is adequate for half the population. Otherwise, the safe limit is somewhere, now it's brought down from 1 gram to only 1.8 grams per kg body weight in our guidelines. So these are the limiting amino acids. As I already mentioned, all pulses have a limiting amino acid, which is methionine, which gets compensated when we eat the cereals. This was an interesting study which was conducted in Indonesian infants. You know, some of the infants have allergy to milk, so you can't give them milk. So all these children who were given soy milk instead of milk, at the end of a year, when they calculated the WHO growth parameters of the infants, it was no different from the children who consume cow's milk. This is actually the best evidence to show that infant nutrition, soy milk is a good source of protein for children's growth. Now, the study on proteins for muscle synthesis, there was no difference between the effect of supplementing with soy protein versus animal protein on gain of muscle mass in people who are doing resistant training. That is, bodybuilders can very well take soy protein instead of whey protein and still get the same amount of muscle mass. And this, of course, is the National Family Health Survey data, which is showing still 20% of our people have got low BMI. And women having low BMI will ultimately give birth to children who are low birth weight, who in turn will be low BMI. So this kind of an intergenerational effect of protein inadequate intake needs to be stopped, and then soy gives a wonderful opportunity. UNICEF said that 50% of the growth failure which you see in children at 2 years of age is primarily because what happened in utero. That is, within the womb itself, because of the mother being protein deficient. So these are the vulnerable population where soy protein can give an advantage, like newborn with low birth weight, adolescent girls with low BMI, pregnant and lactating women, and also women and men from the low socioeconomic group. But of course, protein alone is not the issue. Protein and micronutrients are both needs to be provided if we need the population to get better. And this is a study which was done at Avinash Lingam University some years ago, where soy protein isolate was given to children 1 to 2 years for a period of 1 year. The outcome was there was a significant improvement in the weight, height, mid-upper arm circumference, height and chest circumference, which are the parameters of growth. And the best was seen when soy protein isolate was given at 62 gram level. And the next best was at 49 grams. 49 grams of soy protein was equal to the ICDS total calorie intake. In both cases, the soy protein intake improved the growth. So study had actually convincingly demonstrated the soy protein isolate food mix in the daily diet of malnourished children had a significant benefit. Now, Professor Rameshan, I would like to warn you that if you were to have an expert committee meeting on the use of soy protein for the public health benefit, I am sure one of the experts will raise one of these questions. So I will tell you what those questions are. Number one is soy has too much phytate and therefore it will inhibit micronutrient absorption. You look at this chart, Bengal gram, black gram, lentil all have much higher amount of phytate than soy actually has. And then next is soy contains estrogen-like substances and therefore it can cause some harm. So yes, soy contains isoflavones, so do all other legumes as well. Now these isoflavones are a class of plant-derived compounds. Soy isoflavones are known to have weak estrogen-like activity because their structure is that of a 17-beta estradiol. And actually, it gets potentiated by the gut bacteria. It is found that Asian population, especially Eastern population, have a higher amount of this estrogen-like activity than in the Western population. Now, the mean isoflavone intake, if you see in Japan, was 30 to 50 milligrams per day. Among Indians, it's only 18 to 22 milligrams per day. Now, the mechanism of action of the estrogen-like effect of isoflavones is they bind to the estrogen receptor, which is true, and they do produce estrogen response gene activity, but the receptor to which they bind are the ER beta and not the estrogen receptor alpha, and therefore they have different exact opposite action like estrogen on breast epithelial cells, and therefore they have got an advantage in reducing the risk of breast cancer. They have a pro-estrogen-like effect in the bone, and therefore they are beneficial in osteoporosis. So these are the differences in the estrogen-like action of the soy isoflavones compared to the body's own estrogen. Now, estrogen and cancer, there have been a lot of studies, meta-analysis, etc., which found that when you compare the women who had a higher intake of soy isoflavones compared to women who had lesser intake, there is a 29% reduced risk of developing breast cancer. And you know that among the female cancers in our country, the number one now is breast cancer. It is no more the uterine cervix. So there is a tremendous therapeutic advantage of using soya here. American Institute of Cancer Research has shown that there is limited evidence to show that, the consistent findings show that population studies indicate there's no risk of breast cancer survivors. There's also an issue that if a woman has already developed breast cancer, can she take soya after that? Will it cause recurrence? Then they've shown that American Institute of Cancer Research said that no such effect occurs. But soy isoflavone supplements have not shown to be any advantage, which soy has. And phytoestrogens are structurally and significantly weaker than human estrogens. And they do not become estrogens in the body. That's also another myth. Some people say when you consume soya, the estrogens in the soy actually becomes like human estrogen. There is no evidence to that effect. The higher intake of soy and soy isoflavones were inversely related with the risk of the cancer incidence. And these findings support the recommendation to include soy as part of a healthy dietary pattern for the prevention of cancer. Now coming to soy and osteoporosis, we know that osteoporosis or brittle bones is a major problem among women in the postmenopausal years. And this is primarily related to the low calcium intakes during adolescent period, and also the women lose a lot of calcium while they are breastfeeding the babies. And here they found that when they compared the women who had soya milk versus the women who did not have soya milk, there was a 50% reduction in the risk of developing osteoporosis. Another study also showed, for comparing women who took milk every day or dairy product every day compared to those who did not, there was a 62% reduction in the osteoporosis, which means the benefit of soy of reducing osteoporosis is 56% compared to milk, which is 62%, which is essentially very close to each other. And lastly, on cardiovascular disease, of course, I already mentioned it's low cholesterol. So there have been 10 prospective cohort studies, and there were a total of 17,000 people. There was a significant negative association was shown between soy intake and risk of cardiovascular disease. And we do know now cardiovascular disease has become a major cause of death and morbidity in our country also. And there was no association between soy isoflavone consumption, risk of cardiovascular disease or stroke or coronary heart disease. So hypercholesterolemic effect is permitted as a claim in the US FDA, but not in our country. And there are several studies to show that cholesterol levels can be lower. Then lastly, coming to soy and endocrine functions, there are several studies available evidence shows that soy isoflavone intake does not adversely affect thyroid function. This again is an issue which people say that it may affect thyroid function. It does not. In fact, there are more antithyroid components in cruciferous vegetables like cauliflower, broccoli, and other things rather than soy. Then there was a study which showed that although the menstrual cycle length may be slightly increased, ovulation is not affected. Adverse effect of isoflavone intake were not identified in children, but research is limited here. Extensive review has shown that evidence does not support classifying isoflavones as an endocrine disruptor. There was also issue that since it's got estrogen-like action, if males consume it, whether it will reduce the sperm content, that has also been studied, and there have been no evidence, simply because the basic mechanism is through estrogen receptors, but a different kind of estrogen receptors and having almost an anti-estrogen-like effect. Thank you very much.